Hey, hi Alice. How are you?
Hi, Doctor. Yeah, not too bad.
Okay, that's good. How's things going on ever since that we met last?
Look, I've come in because I'm actually not being great, and I've come in about my skin.
Right. Okay. Can you please tell me more about your skin and what makes you worried?
Well, look, it's all over my face. It's my acne. I can't hide it. It's really affecting me. It's affecting my, I'm not happy at school. I'm not happy, in my relationship, and so I've got to do something about it.
Okay. Sure. Yeah, I understand that it might be, concerning and frustrating for you, but can you, if I can ask you a few questions first, and then we see how we can help you. Is that okay?
Yeah.
So how long have you got this acne for?
Oh, look, I think it's got to have been for a couple of years.
A couple of years.
I've just tried creams and nothing seems to work.
And can I ask what kind of creams have you used so far, or what kind of treatments have you had?
Oh, I haven't been to the doctor before. I've just been to all the chemist creams.
Okay. Do you remember the names?
Like Proactive or Clearasil.
Okay. And they didn't help?
Oh, not much.
Okay. And during this time, does it get better or does it get worse recently?
I think it's just continued to get worse. It's certainly not gotten better.
Okay. Anything that you ever tried and makes it worse?
Nothing that I can think of.
Okay. And as far as I remember, you didn't have any medical conditions in the past. You had a healthy girl, right?
Yeah.
Okay. And are you on any medications or any supplements at the moment?
No.
Okay. And do you smoke or do you use any alcohol?
No.
Any drugs by any chance?
No, I don't use drugs.
Okay, good. And how this acne has affected you, or the rash that you have affected your, performance at school or at life? Any recent changes?
Yeah, it's just getting me down. I think people are treating me differently at school. People are calling me names. I'm pretty sure I'm being excluded because of my skin, and there's nothing I can do about it. I feel like my boyfriend's doesn't really like me as much, and he doesn't want to be with me because of my acne. So it's just terrible.
Okay. Yeah, sorry to hear that, but I'm pretty sure that we can help you here. There are treatments available for acne. But if I can ask, where the acne are, except your face, do you have acne anywhere else in your body?
No, just on my face. Where do you mean?
I mean, in your body, in your chest, in your back, in hands?
No.
Nowhere else. Okay, great. And if I can ask you a few sensitive questions just to, help to diagnose better.
Yeah, sure.
Is that okay? Okay. So, are you sexually active?
Look, I'm not, but we've talked about it, and I think that we will be. But actually, then I think that maybe my boyfriend doesn't because of my acne.
Okay, all right. And are you taking any contraceptions, like any pills or something?
No.
You don't. Okay. So there's no chance for pregnancy.
No.
Okay. And have you had your pap smear done?
No, I've never had sex.
Never had it. Okay. No. And how's your periods? Are they regular?
Yeah.
Okay. And do you have a lot of bleeding, a little bleeding? How's the bleeding?
No, I think it's just normal. I think it's never bothered me too much.
Okay. Any pain during your period or before that? Severe pain?
No, not really.
Okay. How's the situation at home? Are you living with your parents or?
Yeah. Look, I live with Mum and Dad. Mum knows I've got a boyfriend. Mum and Dad are fighting a bit at the moment, but yeah, other than that, yeah, they're at home.
And you are getting along good with your friends? Everything is okay?
Sorry?
How's your relationship with your friends? Are you getting along with them?
With my friends? Yeah. I've got some friends. I think I'm missing out on some friends because of my acne, and certainly it's affecting my relationship with my boyfriend.
Does it affect your mood by any chance?
Yeah, it gets me really down.
Okay, all right. And the other thing that I wanted to ask you is, how's your diet look like? How's your diet?
Yeah, I guess I eat like sandwiches for school. I just eat what Mum cooks. I mean, I like sort of nice food, takeaway occasionally. Mostly, pretty well.
Any changes in your weight?
No.
Okay. Okay. All right. Any changes in your hair or in your mood that you noticed recently?
Or just getting down, and I just occasionally sort of think about really bad stuff, but that's it.
Okay. All right. So would it be okay if I examine you?
Yeah, sure.
Okay. So can I have a look at the patient's general appearance and vital signs? Hello?
Alison, do you want to give these or?
Yeah, sorry, I was on mute and I was talking to myself.
Oh, okay.
So look, she's a slim, well-looking young woman, and her BMI is normal. She's 170 centimetres and 59 kilos.
Okay. And in terms of acne, only cases involved?
Correct. She only has facial acne. However, there are open and closed comedones, papules and pustules, and signs of active inflammation.
Okay. All right. And nothing else? No other rashes?
No, there's no other rashes. Nope.
Okay. And hair and nails are okay? They're normal?
Yeah, hair and nails are normal. Hair is in a normal female distribution.
Okay. Any excessive hair in face?
No, no signs of excessive hair.
Okay. All right. I will go back to my patient.
Okay, we're 8 minutes. We're 8 minutes into the 19 minutes.
Okay, great. And in terms of investigation, if I can order a blood sugar finger prick test?
Yes, but there are no results available for you today. The machine's broken.
Okay. All right, no problem. So I will go back to my patient. All right, Alice. Can you hear me, Alice?
Yes.
Okay. All right, Alice. What I can see based on what you told me and what I observed is that you've got acne. So, do you know anything about acne?
Well, not really. I'm not sure. No, you tell me.
Okay, sure. So basically, especially at your age, because of the excessive, we've got some kind of little glands under the skin, and the main job for them is to producing some kind of oil to make to protect the skin. And at your age, especially because of some of the hormonal imbalances, and because they are producing a lot of oil, and on the skin, there are some bugs and there are excessive cells and there are oil. So they all coming together and block that kind of duct that they have underneath. And so all of that oil accumulated inside, plus the bugs coming and they make it infected. And that's how this kind of acne would be developed. Is that clear so far? I can draw a picture for you.
Actually, I love pictures. Yep, so I think I'm happy to see pictures.
Yeah. So basically, that's the glands under the skin, and these are the ducts, and all of that oil coming out from that gland toward the skin from that duct, and that's how it's blocked by excessive cells and oil and bugs. right?
So what
So
does that mean?
and that's how.
Yeah, what does that mean in terms of what we need to do?
Oh, yeah, that's a good question, actually. You need to know that that's not your fault, so you shouldn't feel bad or guilty. That's a very, very common condition. It might be a bit severe in your case, but, it's a very common condition. So what we need to do is to trying to reduce the oil on the skin. So I would advise you to and suggest you to wash your face with soap and water regularly to take out this oil, take away that oil from your face, the excessive oil that you have. It's going to help the blockage to be resolved. The other thing that we can do is to reduce the excessive cells that we have on.
Excuse me, Ryan. We're 11 minutes into the 19 minutes, so we've got 8 minutes left.
Yes, thank you. So, yeah, and there are some medications like, retinoids that we can use topically, or even if we have to, and it is getting more serious, orally, to reduce that amount of cells on the skin and resolve the blockage. And obviously, because we've got that third component is bugs, so we can kill that bugs with topical antibiotics. And if it's getting more and more severe, or if it's not getting better after a few weeks, like 4 to 8 weeks, we can try oral antibiotics. Is that clear so far?
Mm-hmm. Yep, sure. So I'm going to have to wait a little while till it's actually working.
Pardon?
So I'm going to have to wait a little while till it actually starts working.
That's right. It takes around 4 to 8 weeks for them to work.
Yeah.
Would it be okay with you?
Yeah, that's fine. So I'll start the creams first then. Okay.
That's right, yeah. Meanwhile, you need to know that in terms of diet, you can eat everything. It's not shown, it's not proven that any kind of diet would be affected by acne. But the thing that you need to avoid is picking and squeezing the acne, because they can leave some scar in your face if you squeeze them. I know that might be very tempting to squeeze them, and it resolves the problem suddenly, but later on it's
I don't want scarring. I think I'm worried about scarring, so no, I'm happy to start treatment.
That's good. Yeah, not that you need to be worried about. Even if you have a scar, we can resolve that scar with laser treatment later on. But obviously, you don't want to have excessive and unnecessary costs in the future. So better to avoid that. And I'm pretty sure that it would get better with this treatment. If not, we can go for the next stage, which is going to be oral treatment. In terms of oral treatment, we said oral antibiotics and oral tetinoin, which is another very strong treatment. But you need to know that if you want to start that oral treatment and oral tetinoin, we need to make sure that you are not pregnant, because it's going to have a very, very bad.
Yeah, I'm not pregnant now. I'm definitely not pregnant now. Is there any other options? Sometimes, are there any other options?
Like what kind of options are you talking about?
Some of my friends who have acne go on the pills.
Oh yeah, so that's another very common scenario. So some people are needing some pills, and definitely pills can help them to have hormonal balances. So because we've got in acne, we've got sometimes have some kind of hormonal imbalance. Pills trying to help to balance the hormones. So you can use pills and you can kill two bears at the same time. You can get better in terms of acne, and you can get some contraception effects from the pills as well. Would it be the case for you? Would it be the thing that you are looking for?
I think that's what I thought. I thought I might like, but I'm happy to start with what the first thing is. Whatever you think, doctor.
Yep. We can even use them at the same time. If you need to start any pills, that's all up to you. We can start pills. We probably need to ask a few questions in a different session. Make sure that pills is a good option for you, because it's got its own pros and cons and its own contraindications. So we need to find out that part.
Hopefully that'll get everyone off my back at school.
Yeah, I'm pretty sure that you will be fine because, you know, the treatment is going to be very promising. So,
cool.
yeah, and you shouldn't feel isolated. You shouldn't feel that you can't communicate and socialize with people just because it's for acne. There are definitely treatment for acne, and it's going to be treatable. So, but just make sure that if you're using makeup, don't use oily products because it's gonna make the problem worse. And sunscreen, if you want to use one, which is very important to use sunscreen, especially in Australia with this much of UV that we've got, just make sure that you use sunscreen without oil products and, you know, not oil based. All
right. Okay, good.
So I'd like to see you in around 4 to 8 weeks.
Okay.
And if anything in between, if you've got any concern, just come back to us at any time.
Yeah.
Okay.
So
do you have any question or concern?
Yeah, no, I'm really happy. I want my acne to go away. I think, you know, that will help me at school. I think I'm a bit worried that it gets me so down sometimes, but I think this is really going to help. Is there anything else I can do, you know, about how it makes me feel?
About how do you feel? If you feel that, if you really think that, you know, acne it makes you that affected, probably we can get some help from psychologists to, you know, give you some strategies to cope with your stresses. And they do even have some offering some kind of very effective advice and ways to get away from their stresses. It's called, you know, CBT, which is, you know, cognitive behavior therapy. And basically they're gonna, you know, support in that kind of matter to cope with their stresses and, you know, some kind of techniques to get away from that stress. But I can assure you from the medical point of view that the acne is going to be treated very quickly, like in a few weeks.
Yes.
And you'll be fine. Is there any?
No, I'd like to come back and talk to you about, you know, about the bullying and about my parents and stuff. So yeah, that'd be good.
About what? Sorry, say it again.
About the bully, about the school, people give me a hard time at school, and about my parents. And that would be good. Yeah, yeah.
Oh, okay.
I'd be happy to do that.
Okay. So you believe that the other people at school bullying you?
Oh, like they're like calling me names and stuff and excluding me, and Okay. But I think, like I said, I'm happy to come back and talk to you, and I'm happy. You know, that my acne is getting fixed.
What we can do is, if you like, we can get your parents involved. We can get your principal at school involved to help you in that regard for bullying, because bullying is a serious thing for us, and we definitely don't want anybody to be bullied. So if you are happy,
you know what, I would like that, because I would like that it doesn't happen to someone else, because I think it's pretty unfair. Yeah.
Of course. Yeah. I definitely agree. If you agree, I would call your parents to have a family meeting, and I would call your principal to get them involved to make sure that they have, you know, things that
Mum said she's fine to come in. She'll come in next time. Yeah. Yeah.
So definitely, we can book an appointment as early as possible, like within a few days. Okay, and we get your school involved too.
Cool. So do I need to have a pap smear now, or is that something I can wait?
You know, once you start having sex, 2 years after you need to have pap smear, but gardasil vaccine, that's what we are looking for to do for you.
Yep. Okay. All right.
Thanks, Lisa. Thanks, Ryan. That was really
well done, Ryan.
Great.
Staying power, 19 minutes.
If anyone has any questions about that case, could you please just pop them in the chat box, and I'll let Alison just give you some more information about the case study. Hello, Alison.
Sorry, that's me on mute again. Eventually, I'll figure that out. Sorry. So look, I think that was a good chance. It's really hard to stand up and do these things in front of a group, or even when it's only online. Long cases tend to be the thing that people worry more about. You've just got more time that you have to fill in. So with the long case, establishing rapport is a big part of it. And I think when we get nervous, we have a tendency to just ask questions, and particularly closed questions. Patients usually want to give you information, they want to talk, so try to remember to take a breath and ask the open questions, how are you feeling? So Lisa was to give you some, I mean, you got all the information about the actual acne itself, and you got her past medical history and all those sorts of things. But there were bits of information, you worked your way through the head's assessment, but there were times when Lisa gave you sort of an intro into another area that she was worried about. So you can see those on screen now. So she's concerned about bullying. She's concerned that her parents are fighting. She's getting sad at time to time, and she's thinking about being sexually active. So in a long case, these are all extra issues that they want you to recognise. You're not going to have time to go into all of them, but you want to signpost them. Like, so when Lisa, i.e. Alice, says, oh, you know, I'm being bullied at school, you don't want to just say, aha, yep, and move on to your next question. You want to stop and say, that must be really difficult for you. What's the worst part about it? And you should be doing that in your day-to-day consulting too. So likewise with your management, that was quite good. So talking about how she's going to manage the acne. I think what Lisa was getting at was that the picture of the acne suggested that it might be heading towards cystic acne, and it may be that you need to move not just onto topical straight away. You might be looking at moving on to something like an oral doxycycline or your OCP, and may well be looking at needing referral to a dermatologist to talk about retinal retinae.
Can I just interrupt for a short? Sorry,
yeah.
No, that's not. Just coming back to your previous slide, I just wanted to second what you said then, which was often in the long case there are other kind of more sensitive. Sensitive issues like bullying, like domestic violence, like gambling, things that are a little bit more sometimes hard to apply a structure to. And if you do your, oh look, I'm sorry to hear that, but go straight into an open question, it gives you breathing space. You can, oh crap, I can't remember how to manage gambling. I can't remember how to do that. Go straight into an open question, because what happens is that the role player is given, the way they're designed, a piece of paper with all of this. Some information is to be given directly to you. Others requires prompting, and there's quite a lot of information that they can actually give you. So make sure you ask plenty of those. Tell me more about it. Can you explain it to me? That sort of thing, because they've got quite a lot of information just to hand you right there and then.
Yep, no, that's good advice. So we'll just move through because I know we're running a little bit behind. So basically just as feedback, make sure you're following your patient cues. So try to take a breath, even though you'll have your questions written down, try to follow those cues, as Lisa's also said, and make sure you've got your follow-up arranged, which I think you did a reasonable job of, Ryan. So we'll pass over to questions.
Okay, so we've got a question here from Latika. In short cases, do we have to cross-check any information given in the STEM, like current medication, past medication?
No, you don't. You don't have to. You can. So lots of people find that it can be helpful, and particularly if it seems like there's something missing. So in social history, if all they've given you is whether they're a smoker or a non-smoker and not their alcohol or their drug use, then you might want to fill that out, but you don't need to rattle everything off. But likewise, just because it's listed there on Ramipril, you might want to say, oh, do you take anything over the counter or anything that's not prescribed for you? So
yeah, I think that's. But people often struggle with that a little bit. And I think then the answer is how relevant is it to your case? So if it's about substance use, then you do want to ask about all substances and all, particularly like you said, over the counters. You know, use all the specific terminology. And if it's a focus question and it says family history, Neil, you say, well, can I just check there's no history of autoimmune diseases in your family, such as thyroid disease, type 1 diabetes, or vitiligo, for example. And then you've made it really clear, and they can just say yes or no. But just occasionally, you can do that sort of thing.
Thanks for that, Lisa. Just another question from Kwang. Is a 16-year-old too young for doxycycline? Is it too early for bone development?
No, it's not. So my understanding with doxycycline is adolescence is okay. It's usually it's more to do with their teeth, and so once they've week 16, doxycycline is usually fine. But you could certainly raise that. If you're not sure, you could pose that with, I would normally consider something like doxycycline, but I would just have to refer to NIMS or therapeutic guidelines to ensure that that was an appropriate therapy given your age.